Dear boomers, has your doctor ever told you, quote, you have cancer? Hmm, that's a difficult one. I did an interview with Stan Goldberg years ago. I believe that book was published by New World Library, and he was telling us on that video what happened to him when he was told that he had cancer. It was amazingly freaky, you know. It made him upset that first moment of hearing the diagnosis before you feel like, well, what can I do about this? That moment between the reality of hearing those words and then getting to work to do either what you feel is important to do combined with the doctor's recommendations is what we talked about. I tried to repost the video that I did with him, and since it did not work, I decided to tell you about it. He talks about how a diagnosis of cancer can really turn everything upside down. It is a very, the society reviews cancer in a very negative way. Um, there are a lot of remedies these days, but both allopathic and holistic, that are helpful to people. Um, and it doesn't have to be a death diagnosis, it doesn't have to be a death toll. So, the initial reaction, as we just said, is freaky. And then, um, it's the kind of thing where you think it can't happen to you, but it might happen to other people. And at any time, I think that if you um, get the right nutrition, I mean, maybe there is no way to really prevent cancer. I don't know. I think that, hey, but, hey, but cancer is something that is prevalent in our society. It's very prevalent. So we have to. His book is about 48 things to do when you hear those words, and he shares his personal experience. As he said, he was in shock. He had a cascade of emotions that ran the gamut of anger, confusion, and denial. And then he said that these reactions are normal and valid parts of processing such life or altering news. So there is a period of time shortly after hearing the diagnosis that you become emotional, go into an emotional shock. It may not be the time to give that person suggestions to force them to make decisions. Sometimes it's just a time to hold their hand and not say anything. And as a nurse, I've run into this as well. Um, I one time had a cancer scare of my own. I had a breast lump that required a biopsy and removal of the lump, and I had to wait about 12 days before I got the diagnosis, which was not cancer. It was a what is called a fibroadenoma, which is a fatty tissue. In that 12-day period, I sat by the river that ran by our house and I thought about my life. What is it that I want to change? Do I need to change it right now before I knew what the diagnosis was? But I did figure out that I needed to change everything about my life and maybe change everything about my life anyway. Change the way I think, change things that I eat, do more walking, which I've always done a lot of walking, and basically change the way I view the world, which has often been a little paranoid. So, the cancer caregiving situation, and the caregiver has a lot of responsibility. You have to be careful of what you say to them, and you want them to be as calm and in a stress free environment as possible. And a healing Presence is very important with cancer. When somebody receives a cancer diagnosis and you're the one who possibly gives the diagnosis, although usually the doctor does that, but as a nurse, you give the most incredible healing vibrations surrounding that person as possible. And it's an art. Um, Instead of saying, let me know if I can do anything, that's so vague. So, can I pick up your groceries today? Can I do your wash? Can I clean your house? Um, would you like me to drive you to your next appointment? Those things are very important. And respect the patient's perspective. Some people view their cancer as a battle to fight. Others prefer the focus on coping and living with their condition. And others listen carefully. And it's important to listen carefully and mirror the language and attitude that the patient has and uses about their situation. Be careful of saying things that are well intentioned, and framing cancer as a heroic battle can lead to guilt or failure if the patient doesn't win. Instead of focusing on these things, support the person's individual journey, whatever form it takes. Maintain normalcy, normalcy when possible. And I would say have meaningful conversations with that person if that person is open to meaningful conversations. And what I mean by that, we need to all look at our own attitudes about death and dying and bringing death out of the closet. And the only way to bring death out of the closet is to talk about it. And having cancer can be all-consuming. The cancer treatments are take you away from your ordinary life. In some cases, you might have to do chemotherapy once or twice a day for a period of time, and to shrink whatever tumor might be there that hopefully hasn't spread to the lungs or the brain. And then radiation treatments, and oftentimes that's twice a day. That takes up your life. And if you are still working, and if you don't want anybody to know, you have to be very calm, very calm. And self-care is probably what we all should be practicing, no matter with a cancer diagnosis or not, taking care of yourself. I live alone, so I can take lavender baths. I can take my dogs for longer walks. Take self-care and taking care of my dogs to me are about the same thing. And caregiving can be an emotional drain, and physically draining. And take care, if you're the caregiver, take care of your own needs and avoid burnout and maintain your ability to provide support. So that's like in the airplane, when the plane is going down, you have to make sure that you're taking care of yourself by taking in that oxygen so that you can feel strong enough to help others. It's important to communicate well with someone who has just been diagnosed with cancer. And we speak and we listen with care, compassion, love, going through the heart to the brain. Synchronizing the heart and the brain brings about a total healing vibration within yourself to that person. So practice active listening. Don't interpret what they're saying any other way than how they are saying it. Reflect back what they've said, but don't be obvious about it. I think reflecting things back has turned into a cliche and is almost fake. Listen, and if something comes up that is meaningful to say it. But don't do this, I hear you saying that, that just doesn't work. It doesn't work anymore, if it ever did. Embrace empathy. Use nonverbal communication. A gentle touch and holding hands or offering a hug if appropriate and welcomed and that hug can be very welcomed, and because people are not used to being touched. That's the bottom line. We're not hugging each other or touching anybody. um, be present, be very present with the person. um, your presence alone can be comforting to that person, and don't feel pressured to fill silences or always have the right words, because we're not going to be able to have the right words all the time. And offer hope. um, I guess hope can be unrealistic. We have to be careful about that. But I think hope is the act of having a positive mental outlook and avoid false optimism. Now, as far as yourself is concerned, be optimistic, be hopeful. This is the way you treat yourself, but the way you treat yourself may be a little bit much for somebody else. Be honest and supportive without making promises you can't keep. So, okay, the things you don't do: avoid repetitive sympathy words like, I'm so sorry, I can't believe it, that kind of stuff. Once is okay. I'm so sorry. Once, say it once. But repeating it can become a very tiresome vibrational field that doesn't help anybody. Do not force conversations. If the person doesn't want to talk, that's fine. And sometimes silent companionship is what they need. We all need silent companionship. That's why I love my dogs. Don't give unsolicited advice. Oh my gosh. Unless asked, of course, refrain from offering medical advice and suggesting alternative treatments. That's your business. If they want to know something and they want you to research it, of course, but don't just hand it out like without any regard for what their belief system. So you have to trust that their medical team and the patient is is doing things that are informed, and that the patient is agreeing upon the treatments. Now, it's okay to talk to the person if they want to know what they should do or how they should do it, and that's fine. But don't offer the advice. Don't offer advice that's not well taken. And avoid platitudes. Oh, well, you know, whomever is up in heaven, and maybe you'll join them, or everything happens for a reason. Oh, that's terrible. Terrible thing to say, I think. Staying positive can actually feel dismissive to the person who has just been diagnosed with cancer. And so we have to balance treatment with well-being, the quality of life, to maintain the quality of life. And it's a significant concern for the cancer patient to maintain a quality of life, and it requires a delicate balance between aggressive treatment and overall well-being. Palliative care plays a crucial role in addressing the issue. Now, palliative care usually implies that the person is going to die. They know they're going to die, and so you give palliative care to keep them comfortable. That can often involve hospice care. Palliative care physicians are adept at managing pain, says Dr. Goldberg, and they clearly understand the importance of quality of life, the importance of managing pain, and the futility of trying to keep somebody alive when that person probably doesn't want to be kept alive. Not everybody wants to be kept alive, and they might be willing to let go of this life. They may not have all the ducks in order, they may not have all their papers in order. It might give them a little bit of a chance to do that. So we need to think about holistic care for cancer patients. While treating the disease is vital, equal attention should be given given to managing symptoms, alleviating pain, and addressing the emotional and psychological impacts of cancer. And this comprehensive approach can significantly improve a patient's day-to-day life and overall experience during treatment. Complementary therapies are wide. There's lots of stuff. The person has to figure out what would be best for them. Meditation, Tai Chi, nutrition, physical activity tailored to the patient's ability to move around, and their energy levels. They might be very tired. Music therapy, support groups are very important with cancer patients. And hospice. Hospice is something that Dr. Goldberg is very familiar with. And people can get involved with hospice long before they think they're going to die. And hospice can be very, very helpful to people who want that kind of care. They get visits from the hospice nurses. They get close to their hospice nurses, and the end-of-life care options is an important aspect of what a hospice care person can give, and regarding comprehensive cancer care. Hospice care, which is often misunderstood and avoided until the very end, offers numerous benefits for patients and their families. That's what I'm saying. Get involved with hospice earlier than later, so you can have the benefits of what they offer you. They're very, very wonderful people. So we need to, as caregivers with cancer patients, focus on the quality and comfort of their life, comprehensive support for them, care provided in familiar surroundings. A lot of people want to die at home, and pain and symptom management is very important for the hospice person. Early hospice is very important to Dr. Goldberg, because he says even though people could get into hospice for 6 months, for whatever reasons, they weren't coming in until they were so close to the end of their life that by that time there isn't much that a hospice experience can actually provide. And there is a common misconception about hospice care, that it's only good for the last few days of life. Earlier engagement with hospice services can significantly improve the quality of life for patients and provides valuable support for families throughout the end-of-life journey. And it can become a really great thing to do for everybody. It becomes a family affair. So we can look at our own concepts of mortality, immortality, as we travel this end of the road kind of experience. And we need to be cognizant of what this diagnosis, not only what this diagnosis does, but what it can teach us, how we can change our lives, maybe to beat the disease, but maybe to die with open eyes, a love for life, gratitude for the life that we just lived. So I am going to get Dr. Stan Goldberg back on my show here. He's written another book that I like. Oh my goodness. It's about, it's about this kind of topic, but it's not exactly cancer. It has to do with other aging kind of things to think about. When we get old, there's so many things that we can do to enhance our lives, and that's what that book is about. So there's going to be a video that shows up here. Take a look. tomorrow I might return to the topic of our 2024 presidential campaign. But right now I needed a little break from that, and I hope that you are all well. Bye.